Every week we have a chance to talk to the Minister for Health and Social Care. Sometimes it's on Sundays, sometimes we get bumped. We're actually on Monday today, correct? David, thanks for joining us. A busy time yet again. We're going to do a Q&A, but I think it's best if I start by trying to get us up to speed where we are today. Because is it going to be a press conference this Monday or not, first of all?
There will be a press conference later this afternoon. It'll be a general update. And we may have something to say around the circuit breaker as well and the period of time for that, but that's not defined yet. There's still decisions to be made in that area.
So I'll read something to that. You can tell me to bat it off at all. But information, good news about circuit breaking, I presume then, yes?
Well, no, we're looking at the data to see whether it needs to be extended or not. And we may have further information this afternoon, but not at this current time.
So are you going to do an update every day, or how are you going to play this?
No, so the last couple, we'll be keeping to the format the same as we have the last couple of weeks. We tend to do one on a Monday after the weekend is over, and also on a Thursday after Council and Ministers has met on the Thursday morning. Should we need to do any other briefings because there's something important to inform the public of, then as people will have seen, we will do that at very short notice if necessary.
Okay. Let's talk then about other things to do with, obviously. People have been quite happy, I think, overall with the new dashboard. I think that's been quite interesting, the response you've had back on that. I think what the public has always wanted is information.
Yeah, it is, and the information's always been there in a data format, but not necessarily in the graph format that the Power BI allows you to do and play around with. So we've had the open data on the website for quite a long time, but of course, unless you're used to working with CSV files, etc., it can be sometimes unwieldy. The feedback I've had on the dashboard, and I've had just over about 100 people contact me in relation to that, has been very, very good. People really like it. Important to stress, this is a version 1. There's possibly going to be updates to it as we move along, and nothing's set in stone. But certainly the public feedback at the moment, just like when we launched the vaccination dashboard, is that people have taken to it.
I still see the figures going up. Well, it depends which of the graphs you look at and what it's actually saying. We're not there yet, are we? We haven't plateaued, or have we?
We're not. What is encouraging is the unknown infections, so the infections where we don't know where they've come from, are decreasing, as you would hope to see decreasing at this point. And most of the infections are coming from household transmission, with the Kent variant being much more transmittable. It's basically no surprise that when you're in a household with someone who's positive, the other members of the household tend to go down with it as well, but slightly later than the other person.
How's 111 doing? And this brings back to my question I put to you the other week, which you didn't have the answer to, which is unusual. And hopefully you've got an answer now. How many people are working on? How many people did work on it? How many people are working on it now? And have you got everything in place to make sure it is up to?
I still don't have those figures because I have to be provided them by Cabinet Office, because I'm not Minister for the Cabinet Office. DHSC doesn't run 111, but I believe they have brought a lot of extra people in, was my understanding from speaking to the team. I believe the level of calls has actually dropped now, as we expected. We did say all along that it'd be about 7-8 days where it would be absolutely under the pump, where they were arranging tests. They had cases coming at them everywhere, including contact tracing. But in relation to that, I believe from the update I had this morning that the number of calls is now plateaued off into the weekend, and it's back to more manageable levels.
See, people are going to watch this and say, you've got an answer for everything. So it's unusual that you haven't got an answer. I mean...
Yeah, well, it's not my department, is the simple answer. And so I don't have those figures. I have asked for them, but I haven't got them as yet.
Maybe we can find out later. Who knows? As you and me both, we get stories, we hear things. I've got resources, and sometimes very, very spot on indeed. But this one, I want to ask you if you can help me out, because I'm hearing more about cases with steam packet crew members, and that's why you can't book an overnight sailing as a foot passenger. Again, I must state that I do not know this as fact. I'm just putting that to you if you've heard anything, because these stories start running and getting legs if you're not careful.
Yeah, no, I've not heard anything in that regard. Literally, as the Chief Minister announced at the last briefing, there was an issue with more crew testing positive, and that disrupted the sailing, the overnight sailing, the other day. But that was purely due to the fact that they had to switch crews with the boat. So, and that was done. As far as I'm aware, there's no other disruption with the company. But like I said, that'd be a matter for the company maybe to answer rather than me.
Okay. How's it going up at the grandstand? Is that pressure also being relieved now? Because we're seeing and hearing about the queues at one stage last week, certainly.
Yeah, there is going to be large queues because of the sheer volume of people who are passing through the station. The staff, I've got to say, the Swabbing staff have been absolutely amazing. They're highly efficient up there, and they work exceptionally hard in the conditions that they've got. I think they've done exceptionally well. They've been getting through the numbers, and the numbers of tests being undertaken is slowly plateauing off as well, and which you would expect if the calls to 111 are to.
And Nobles Hospital, the pressure there.
Yeah, Nobles Hospital is under pressure. We have the perfect storm, as I think I've referred to it before, of winter pressures and also COVID-19 with people admitted, with us needing to use Ward 2 as a isolation area and also the PPU as well. But again, the main issue around there is staffing pressures, because with the amount of people that are currently isolated and households that are isolated, that involves health and social care staff as well, and including the bank staff we would normally turn to if we didn't have the normal staff. So there is pressures, but again, the staff have done a phenomenal job, and they are coping.
Okay, well, probably this section here, because I've got to find some more questions to ask you later today, by looks at it now, which I didn't know about. But we'll have a Q&A in our next sections anyway. Public have been amazing. The questions, are you still surprised how many people have got questions for you?
I think it's actually good. I mean, it's good that the public are engaged and they want to, there's questions out there they want to know the answer to. I don't always have all the answers, despite what you might say, Paul, but I'm certainly willing to try and answer them as best as I can.